The importance of trying to be objective about your pain is that when you're in pain, and if you've been in chronic pain for quite a long time, it's very difficult to be objective about whether you're getting better or whether you're not getting better. By objectifying, by being more objective about it, it helps you to determine whether the treatments that you're receiving are helping or not. The answer is really no. There's no objective measure for pain. Pain is very subjective. Having said that, being that it's a person's personal experience in what they're encountering, for them it's a good idea to take measures that are subjective and compare them from hour to hour, day to day, week to week. So some of these measures that we're looking at to help determine whether you feel that things are getting better with your pain are frequency of pain, duration of pain, intensity of pain, and character of pain. Those are 4 different things that you want to look at in regards to how you view your pain. So in regards to frequency, you want to take a look at and see how many times you're encountering pain throughout the day, throughout the week, potentially throughout the month. You want to compare from day to day to see if there's any changes in regards to how frequent the pain is. Sometimes what will happen is that when you go through pain, your mind automatically switches back to when the pain started and how horrible the pain has been throughout the experience that you've had. So by looking at frequency, it can help determine whether the pain is diminishing in regards to how many times you actually feel it. So intensity of pain. Okay, so one of the key things that I ask patients is, in the beginning, before we do treatment, I'd ask them, how would you describe the intensity of pain from a 0 to 10 pain scale, 10 being the most painful, 0 being no pain at all. So they might say an 8. After treatment, I'll say, okay, so how about now? What would you say the pain scale or symptom scale is? And they might tell me, oh, it's a 6, so it's dropped down a couple. Again, it's a subjective measure, but it does give the patient, gives you a chance to get an idea whether you feel that your pain is better. So duration is another way that we can look at pain. You might start feeling pain in going down the arm. Maybe that's what you originally came in with, and you might notice that it's painful for the whole day. But as it gets better, you might start noticing that it's not the whole day anymore, maybe half a day. Even as little as, for example, like you notice that your pain tends to last for about 15 minutes in length. All of a sudden, it comes down to 10 minutes. That can be significant over time. So finally, character of pain. That's another measure or thing that you want to look at in regards to your pain. So character could be, for example, the pain could be sharp, it could be radiating, it could be sore, it could be achy. So the reason why you want to put down character is that it gives you an idea, or it gives a therapist an idea in regards to whether things are becoming better or worse. So for example, if you started off with pain that actually radiates down the leg, that's sharp, and you're starting to notice that it's actually localizing, meaning that you feel it more in the buttock or in the lower back, that's actually a potential indicator that things are getting better. They're localizing, they're centralizing, as we say in the rehab field. So when it's radiating, it's usually a lot worse. When it starts centralizing, meaning that it's getting to a point where it's more local as opposed to spreading out, that's generally a good sign. So that's why you want to put down character as one of those objective measures. So this is a simple pain chart that one can use to help them determine whether their pain is getting better or not. So this is something that you can use. I know you might not be able to see it as well, but what I'm going to do is I'm going to have a photo of this in the video so that you can maybe take a copy of it, do whatever you want. You can write this down, photocopy it, use it for daily use. So as you can see on the right hand side here, we have the date. So you put down the date of when you started. It says here morning, afternoon, and night. I'm trying to make this as basic as possible, trying to decrease the amount of complexity with this. At the top over here on the chart, you have frequency, duration, intensity, character, and any notes that you want to put in there, right? So basically, like with with this chart, for example, in the morning, you're going to check to see how frequent your pain was. It might be 2 times you felt it, 3 times, and then same with the afternoon. Duration, you put in whether you felt the pain for maybe 1 minute, maybe 20 minutes, maybe for half an hour, so on and so forth. Number 3, intensity. So from 0 to 10, 10 being the most painful, you mark down like how intense the pain was. And then character here, you describe whether it was sharp, shooting, whether it was referring, any type of descriptor that you have for the type of pain that you have. And then number 5 here, you have notes. So like any notes that you have in regards to the pain, maybe it was something that was triggered by, the pain was triggered by something that you did, or anything that you feel might be significant in regards to the pain. So when you put this down, and you put this down on a daily basis, over weeks what will happen is you'll notice a pattern, and you should notice like a pattern whether you feel like you're getting better, whether it's staying the same, or it's actually getting worse. And this is a great way to figure out, again, how objective you can be in regards to like how you look at your pain. So that's my chart.